As neighbors and partners, the AbbVie Foundation would like you to design and recommend an innovation or process that will improve the lives of patients with cancer. It is important that you focus on the patient. Using your knowledge of health literacy and discovering new knowledge from experts and patients, consider what you can do to find new or improved solutions that make an impact.
From a biological perspective, it's really just the cells within your own body dividing very rapidly and not really knowing when to stop. That mistake gets replicated, multiplied, and soon it becomes a tumor.
So brain tumors, for example, again, it starts as one cell, and over the course of years, it gets to be a certain size. When it gets big enough, then you may have symptoms, and that could include having seizures, difficulty walking, difficulty with balance.
And so patients really feel it when the tumor has grown to the size that it interferes with a normal process in the body. So they go to their physician, they say that something doesn't quite feel right. It can take some time for the physician to figure out exactly what's going on.
So from the patient perspective, I think it helps so much to have and be able to talk to someone. You know, for anything in life, it always helps to have a guide. Just knowing that you're not alone, that other people have done this, other people have done it successfully, and showing you the path that you can take to get there.
At Ronald McDonald House, we provide housing and support for families who are seeking the best medical care for their kids. To me, a patient journey is really everything that goes into a child having to go through this medical experience. A fair amount of our families, they took their child to a medical appointment just to check something out, and then all of a sudden, they are on this unbelievable path where sometimes they are rushing to the hospital for different care.
There are about 3 pillars of treatment that people get for cancer. Surgery is number 1. Obviously, if you can take it out with surgery, you do it. Another thing you could do is radiation therapy. These are really high beams of X-rays, and now we have the ability to actually direct it right at the tumor. And the third mainstay of therapy is something called chemotherapy. Very effective, different types of drugs. There are about 100 different chemotherapy agents you can get.
I think just for a high school student, there are so many different opportunities in the pharmaceutical industry, whether they want to do basic science research, whether they want to do more clinical trial work. The work that we do is not just for an individual patient, one by one, but really to eventually bring medicines to hopefully millions of patients to treat their tumor and to really improve their quality of life in the end.
Well, I recently had an uncle that died to lung cancer this past July. Even though that he's gone, I'm somewhere helping people in the future that won't have to deal with the same loss that I did.
Real change comes from innovation, things that people just haven't thought about. It's groups of people coming together, bouncing ideas off of each other. All you need is one good idea. Got to do this all together.